Hello, and welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists. I'm your host, Raina Andrews, and for those of you tuning in for the first time, I am a mother, book author, a public health ambassador, a TEDx speaker, and really a concerned community member. I'm happy to return as your host of Coffee Conversations with Scientists for the 2024 season. Coffee Conversations is brought to you by Advancing a Healthier Wisconsin Endowment, which is a statewide nonprofit working to improve health and advance health equity in Wisconsin. Now, on today's show, we're talking about a public health crisis. The opioid overdose crisis in our communities is complex and truly ever evolving. Now, the big question is, how do we effectively tackle it? Well, on today's show, we'll explore the powerful role of community-level overdose prevention strategies that empower local leaders to take the reins in opioid rapid response. We'll delve into the innovative and diverse approaches being implemented across the country and really tailored to meet the unique needs of each community. To help us unpack this conversation, I'm joined with Dr. Julia Dickson-Gomez, who is an anthropologist and professor at the Medical College of Wisconsin's Institute for Health and Equity. Together, we'll uncover what makes these initiatives successful and discuss how better coordination among agencies can really save lives. Welcome, Dr. Dickson-Gomez.
Thank you. It's great to be here.
Yes. So for all of you out there in the interwebs, we will be covering a great list of questions regarding community-level overdose prevention. We have a lot to cover in just a short coffee break, so you know the routine. Put your questions in the chat and we'll try to get to as many as possible. So Dr. Dickson-Gomez, what I'd like to do is really level set for our audience who may not know anything about this topic. So to start off, I'd really like us to understand how much of an issue is the overdose crisis? Is it truly a crisis? So can you please give us a broad overview of the current state of the opioid overdose crisis in the United States?
Sure. If I may, I'm just going to share a graphic. Um, this is a chart from the CDC that shows the increase in overdose deaths over time. And as you can see, it has continued to increase since the 2000s. Now, what had happened, where this crisis started was in the 1990s with the overprescription of opioids for pain. So many of the listeners may have seen films like, what was it called? um, the ones about OxyContin and so forth, and about the Sackler
Yes.
family.
Yes.
That was what was happening then. So what happened towards the end of the 1990s and the early 2000s is that states started to crack down on overprescribing, and they implemented things like prescription drug monitoring programs that would check when these prescriptions for opioids were going out and really catch physicians and dispensers that were overprescribing. So there were places that were so-called pill mills that were really cranking out these prescription opioids. A lot of people got addicted, and suddenly the supply was cut off. And so that's when, around 2010, and so the so-called second wave of the opioid crisis started. And that's when people started to injecting and to buying heroin when they couldn't get it from their doctors or from the pharmacy any longer.
What's so alarming in looking at this is the steady and rapid growth upward. It looks like for men
Right.
particularly, yeah.
And so recently, this big spike is when fentanyl started to come into the picture. So heroin flooded the market to take advantage of this ready base of consumers. And so the only way I think that was available for many of these drug dealers to make a profit was to lower the price, and they did that by replacing heroin with synthetic fentanyl, which is much, much more potent And also, there are many different analogs. So, a lot of times users don't know they're getting fentanyl instead of heroin. And if they do, they're never quite sure of the strength. And so that's when you see, and this is, of course, was also around the time of the pandemic, where there were all these social changes that probably exacerbated the problem.
Wow. So this is the view across the United States. This is alarming in the way that it just jumps up. We're in Milwaukee. The base of a lot of the work that you're doing is in Wisconsin. Can you tell us what this looks like in our own backyard?
Yeah, so we're not the worst, but we're worse than the national average. Uh, um, Wisconsin as a whole, it's in the last 5 years, we've been averaging around 1,500 to 2,000 overdose deaths. About a third of those occur in Milwaukee.
Mhm. So
There's been,
yeah, go
go
ahead.
ahead. No, you go ahead.
I'm curious when I see the spike, you mentioned COVID, and I can see people with changed social norms, people maybe take drugs to normalize or level out themselves. What I'm curious about, what are some of the key factors of the constant increase in overdoses?
Well, in overdoses, I mean, the actual opioid use disorder, I think that is kind of a range of factors that have led to that. But the overdose itself, I think, has been led primarily by criminalization and stigmatization. Um, so there are medications that are effective to treat opioid use disorder. Unlike many other substance use disorders, like for stimulants, for example, these include methadone, which has been around for a very, very long time, but is highly stigmatized, and newer medications like buprenorphine and naltrexone, which have a better safety profile. But under 20% of people with an opioid use disorder receive treatment. Often they don't receive drug treatment at all because there's a shortage, but when they do, oftentimes it's not this gold standard treatment, it's an abstinence only treatment. And as another example, so criminalization really and stigmatization kind of go hand in hand. You criminalize something that's immoral. You don't criminalize a disease. So a lot of what has happened, for example, post overdose, often police and paramedics are the first on the scene. There have been passed many laws, like Good Samaritan laws, they're called, to encourage people to call 911 when someone is experiencing an overdose. And basically, it is supposed to protect people from arrest, but it is so inconsistently applied that still, people are not willing to take the risk to call the police sometimes, especially if they think they can reverse the overdose on their own with naloxone.
This is very interesting that you bring this up. Like a big issue is stigmatization and criminalization. And this is the first time that I've heard the term opioid use disorder. So someone who becomes addicted to drugs is considered considered a disorder. So if it's a disorder,
Yeah.
it shouldn't be criminalized, to your point, right?
Right. Well, yes, and that's part of it. And also, you point out the difference in terminology from addiction to opioid use disorder. So the definition has kind of shifted. Earlier, we thought of addiction really as being the physical dependence on a drug. So having withdrawals meant that you were addicted to a drug. So people who are addicted to opioid have very, very uncomfortable withdrawal symptoms when they don't have that drug, including, sweating, vomiting, diarrhea. Um, Now it's really looking not on that physical dependence because you can it's more about what effect the use has on a person's life. So they look at the social, the legal, family relationships. If your use has damaged all these aspects of your life, then you have a disorder.
Mhm. So what I'm hearing is like a big part of the problem is that there are Good Samaritan laws in place to allow for this to truly be seen and treated as a disorder. But instead, due to the stigma around it, and the lack of coordination, that there's inconsistent application of that Good Samaritan practice.
Right. So, for example, oftentimes, if somebody is on probation or parole, they would get picked up because being there on the scene is that they're not supposed to engage in any substance use.
Mhm.
That's a condition of their release. A lot of people who may actually be at a scene may be on paper, for example. Another way that it's inconsistently applied is, you know, based on the quantity of drugs. Sometimes it's, is this person a user or a dealer? Well, that's in practice sometimes a little bit fuzzy.
Yeah. I'd like you to really elaborate on your experience in terms of what the biggest challenges communities are facing when trying to address this crisis. I'd like you to elaborate more on the divergence programs,
Yeah, the
the issues with
diversion.
buy-in. Yes.
Yeah, yeah. So there have been a lot of programs and very good ones, and I'm going to toot a couple of them, tout a couple of them, sing their praises. There are in Milwaukee Fire and West Dallas Fire have some really good post overdose interventions where they've really done a lot of community engagement. Uh, Police diversion programs are similar in that after when there's a police encounter or an encounter with a person who used drugs for some sort of nonviolent offense, they have the opportunity to refer the person to uh, substance use treatment or to harm reduction services, for example. So there have been lots of efforts to have these kinds of programs. They have been more or less successful in different places, depending on the kind of buy-in of officers themselves, whether they actually make the referral, whether there's leadership support, all those sorts of things. And then, of course, there also has to be partnerships with the places where these people ultimately end up. So if you're going to refer someone to something other than jail, there has to be something there. There has to be a drug treatment program there waiting for the person.
I think these are some really good examples. I'm wondering if you can really talk about the importance of collaboration, coordination. I think it's obvious, but like among specific agencies like public health, law enforcement, social services, to really provide like that wraparound service for the person that is experiencing or is at risk of an overdose.
Right, right. So yeah, that's exactly right, because the police or paramedics are often the first, or they frequently encounter people who use drugs, but the services that people need aren't necessarily, they're more long-term care. So there needs to be a linkage to these longer-term services. And that has occurred in a lot of programs. One of the things that MCW has facilitated or helped facilitate are overdose fatality reviews, um, which are generally by health department, but they are kind of exactly what they sound like. They are quarterly meetings where a case of an overdose fatality is selected, and then as much data as possible is gathered to learn as much about the decedent, their interactions with police and various medical services or social services, are all gathered, all with an eye to kind of figuring out what might have prevented this overdose from happening. And so I think this is a really great way, this kind of problem-focused meetings that have occurred have been a great way for these interorganizational collaborations to kind of start to form, saying, oh, if there had been someone here to follow up with him after he had left the emergency department, or, uh, for example, I don't know, could probably give a few more examples, but
So you've given a lot of really good examples and even shouted out some key organizations who are doing things well. I'm curious, and I think the audience could appreciate learning more about your innovative work in overdose prevention, how you incorporate some of what you've been sharing and overcoming some of these barriers.
yeah, so a little bit of everything, but so I've been involved in a lot of different projects. But one of the recent ones was to kind of take a broader look at this system, and what I'm talking about, the overdose system.
Mhm.
Uh, and systems is a way of thinking of something as kind of more than the sum of its parts. And so, for the overdose prevention system, I think what we got key stakeholders together, and we met like 5 or 6 times to try to build this model of what was happening and where people were being referred with their encounters with police, or with emergency medicine, or with harm reduction services, and try to figure out how to link them to naloxone distribution, which is the medication that can reverse an opioid overdose, and or MOUD treatment, and try to like re-divert them from the wrong pathways, which are like going to jail, for example, or to an abstinence-only program, which decreases a person's tolerance to opioids and can actually increase their risk of having an overdose 10 to 100 times. So we did that. We have this plan, and now we're hoping to uh, continuously kind of evaluate how it's working, so we can take a look and say, okay, police referrals are not working quite as well as they should here. What can we do to try to fix that? Or, for example, and we're also trying to collect all sorts of implementation data from these organizations that are involved in these different programs. I don't
Mhm.
know if that,
And
go
what I
ahead.
think is so critical about what you shared, Doc, is that you are taking more of a systems approach where you are working with all of these pieces that have probably traditionally worked in silo, and you're working to coordinate them to work better in concert with a shared
Right.
understanding of this is the goal, this is how we're defining the problem or the issue, and this is the protocols that we're putting in place. I
Right.
think that's really amazing. And when you talk about the key stakeholders, I'm curious about the people power. Could you explain how community level overdose prevention strategies work and why they're so essential using community empowerment, like
Um,
the peer support specialists?
right. So peer support specialists, I think this kind of an approach of looking at a system. So this is a perfect example of a bottleneck. Peer support specialists are people with lived experience who can play a really key role in navigating a person who uses opioids through the system in terms of getting, the support they need, the social services they need, drug treatment, and so forth. There is training program provided by the state, but they have a very limited number of PSS that they train each year. And there are also barriers to hiring PSS because some insurance, it's difficult to, charge for the kind of work they do. So there are all sorts of barriers to, for example, a strategy that we already know works really well. And working together as a group like this, we can try to solve some of these bottlenecks or some of these problems.
So I think that's amazing that we have community-based strategies and are incorporating community members and supporting their peers in overcoming these bottlenecks. Given where we are in our coffee break, I want to turn it over to the audience. So let's take a couple questions. So one of the questions is really requiring a distinction. Like, what is the difference between addiction and substance use disorder?
Yeah, so it was like I was saying, addiction has kind of fallen out of favor, but my understanding of the definition of addiction is that it included that chemical dependence on a substance. So, in other words, when your body got used to having the substance, if it didn't have it, there would be symptoms. Usually they're kind of the opposite of whatever the effect of the drug had. So, if a stimulant gives you euphoria, the withdrawal symptom would be kind of depression or despondency. The newer definitions don't really depend on that chemical dependency. It's really about the effect it has on your life. So when I talk about family consequences or legal consequences, have you had an OWI? Has your family told you maybe to cut down? Have you missed family events? Those are the kinds of things that make up a diagnosis of a substance use disorder.
So if someone says that if someone is referenced as a functioning addict and they function normally, they maybe do cocaine or heroin, but they maintain a job, they still provide for their family, they don't steal, like,
Well, oh, I kind of lost Raina here. Sorry, you're back. I lost you for a minute. Um, I think you were asking about functioning addicts, and whether they would have a substance use disorder. I think we also like to avoid the word addict because it's a little stigmatizing, which is another reason that we've changed. But in terms of if a person uses and they are able to function well in all of then maybe they don't. But maybe they do. I think it really takes an honest look at the effects it's having on your life. But certainly, I think the current uh, the current view is that substance use in and of itself is not necessarily problematic if it doesn't affect other parts of your life.
got it. Another question from our audience is, if not treated, what are the long-term effects of opioid use on a person's health?
Um, Actually, not so bad. If and that's why some places have advocated for prescription heroin or for um, a safe supply. And I guess the long-term effects, I'm not a medical doctor, but are kind of constipation. I think probably it shortens your life over. There are respiratory issues, I think, that are dangerous, obviously, if taken too much. That's what causes the overdose. But I think most of the most harmful parts of opioids is the unpredictability of the supply that you
As you
don't.
mentioned, someone taking heroin and
Right,
fentanyl
exactly.
is laced. Yeah.
So and that affects not only its lethality sometimes, but also can it's hard to maintain um a steady a steady use pattern when the quality varies considerably.
So this is an interesting question. It's like, so if you, if not treated and you have, and if you're taking opioids, what is the impact on your health? Well, besides death, does it not break down your system?
I really don't think I'm qualified to answer that, but yeah, there has been an argument that the health effects are not all that detrimental. That the and certainly the biggest ones are this unpredictability of the supply and yeah, the risk of overdose. And also bloodborne illness if people are injecting and don't have sterile syringes.
I think you brought up a really good point earlier, in the conversation of stigma versus criminalization, where the way that people are treated when they have an opioid use disorder is they will just remove the drugs completely, which lowers their tolerance. So when they do get their drugs or get their fix again, I mean, excuse me if I'm using the wrong language here, it causes an overdose because it completely brings them to extreme levels. Can you say that in another way that's appropriate and more scientific? But
Uh,
am I
That
catching
yeah,
what you're saying? Yeah.
yes, yeah, that's right. That the abstinence will decrease tolerance to their drug so that the risk of overdose increases. And the risk of overdose, for example, after release from jail is 10 to 100 times greater than those who did not have that forced abstinence.
Wow. So for our listeners who are concerned about the overdose crisis in their own communities, what steps can they take to get involved in local prevention efforts? Like how can they support the initiatives, some of the initiatives you've discussed today?
So definitely you can get trained to administer naloxone, commonly known as Narcan. Uh, I think I think we're going to, there's a link that we'll provide where you can look up different training for that and carry it. Obviously, also just I think support harm reduction efforts. I think there's a mistaken fear that harm reduction will encourage substance use, and I don't think that there's any evidence that that's actually true. Um, we're just really trying to keep people alive. Uh, another day. I believe recovery is possible, um, so that's definitely worth it. Um, and I guess finally, educate yourself about substance use and try to avoid stigmatizing language when
We'll
referring to.
include we'll include that link right here in the chat. And are there any websites or anything in addition to what we're linking here that provide specific resources? Are there any organizations or programs you'd recommend for listeners who want to learn more or contribute to solving the overdose crisis, and particularly addressing their own stigma towards persons living with an opioid use disorder?
Um, Well, I think the link that we provided is a good start. Vivint provides a lot of harm reduction services, 16th Street. If you're interested in syringes and Narcan, in fact, there is a Narcan Direct site which will direct you to all the places you can access Narcan, including now there are some vending machines.
Hmm, I've heard about those, yes. Well, this has been a very, very important conversation for us all to be informed on what's happening, specifically with the ever-evolving information with the opioid crisis in our communities. And so with this, I want to thank you, Dr. Dickson-Gomez, for joining us today. We appreciate you taking the time to talk with us about this very important topic. Thank
Thank
you.
you. It was my pleasure.
Yes. And so for those of you out there in the interwebs, if we didn't get to your question, please feel free to send me a note at conversations@mcw.edu. I hope you all join us next month for a virtual coffee break and a conversation with the scientists. See you next time. Bye-bye.
Bye.